So maybe you're a young woman in your 20s and you're used to having very regular periods, and all of a sudden you've not had any periods for 6 months. Or you might be someone that has always had irregular periods, let's say every 2 months, 3 months, 6 months, but you've never really done anything about it. And now the question is, what should I do? Well, the very first thing you need to do is a pregnancy test, especially if you're sexually active and you're having unprotected sex. It's amazing how many women do not actually know that they're pregnant. And that's usually because they have no pregnancy symptoms such as nausea, which is part of the early morning sickness, weight gain in some cases, and they do a pregnancy test then to realize that they're pregnant. So if your pregnancy test is negative, that means you're not pregnant, and the obvious next step is now to see a doctor. So what we'll do is we'll take a history, find out when you first started having periods. Is there any family history of irregular periods or family history of premature menopause, for example, for someone who's not had periods for quite a while, as well as taking a sexual history. Then the doctor would want to do an examination, which would usually be a vaginal examination, checking your state of your cervix, your vagina, checking for infections such as pelvic inflammatory disease, which can cause irregular periods. Also be aware that other causes of irregular periods can be stress. Stress can play a major part in suppressing your hormones, which can cause irregular or delayed periods. Strenuous exercise, especially when you see athletes who do marathon running, or long distance runners, can also have delayed or irregular periods, as well as women who've put on a lot of weight recently. Also think about endometriosis, which is another common cause of irregular periods, and women would usually present with painful and heavy periods. There's usually a family history, and endometriosis is commonly an underdiagnosed condition. And this is usually found by laparoscopy. In some cases, the doctor might send you for an ultrasound, which can show the presence of endometrial cysts, which are also known as chocolate cysts. But the initial most important investigation is to do blood tests, because another common cause of irregular periods is thyroid problems. You can have an underactive or overactive thyroid that can cause period problems. But there's usually clues such as weight gain or weight loss, change in your bowel habits, whether it's diarrhea or constipation, changes in your hair, your skin, fatigue, and other symptoms. Your doctor would also want to do blood tests for your reproductive hormones, such as your LH and your FSH. Now, LH and FSH is what usually stimulates the release of eggs from the ovary into the fallopian tube, and usually if there is no sperm to hit the egg, your LH and FSH levels now drop, and then you have a period. If your LH and FSH levels are too high, for instance, then there's an indication that you might be going into premature menopause, or you might have a failure of your ovaries. Therefore, you need further investigation as to why you might have premature menopause or ovarian failure. Also, you'd expect LH and FSH to be roughly the same ratio, such as a 1:1. So if you're having a 2:1 or 3:1 ratio of your numbers, for example, if your LH is 5, I would expect your FSH to be 5. However, if your LH is 5 and your FSH is 2, that's roughly a 2:1 imbalance of your hormones. And that could be a clue that you might have what we call Polycystic Ovarian Syndrome, also known as PCOS, which can also be found on ultrasound, where you have small little follicles around the ovary that never fully mature to become an egg. And some women with Polycystic Ovarian Syndrome can also have high testosterone levels, which can also cause irregular and delayed periods. Therefore, managing the symptoms of irregular or delayed periods depends on the underlying cause. So if you're someone that's not had periods for 3 or 6 months, do not just sit with it and expect your periods to come, but the earlier you get investigated, the earlier you can be offered treatment, especially for someone who's trying for pregnancy. Because if you're going into premature menopause, then that means you're not producing enough eggs that will cause you to be pregnant. Or if you're someone who's got Polycystic Ovarian Syndrome, then you are at increased risk of other conditions such as diabetes, for instance. So therefore, management is very important in these conditions. Right, so I hope you've enjoyed this video. Please feel free to like, comment, share, and subscribe to my channel.